Well, greetings again. This is Dr. Bill Wyatt, and we're going to talk about it. We're calling this adult orthodontics. It's really not. This is a teenager that's missing a bunch of teeth. But this type of orthodontics is not readily done where you bring the back teeth or the wisdom teeth, or if you got anything behind, slide it up and put it in a space where people are missing permanent teeth along the way. So let's get going with this right quick. Let me touch here. And this is a nice little girl. That's a bad picture here. This is brighter side, and you can see we have the braces on her teeth when I took this deal. Here it was when we started, and you can see the teeth that are missing back in this area, and here how these have leaned forward and tilted in here, and in the front part it looks pretty good right here, but this is kind of a problem back. It's not kind of a problem, it's a pretty good problem. So let's get on with it. You see, now this is like an ectopically erupting 6-year molar may have come in right here, and see it's leaned way over, and this is the anterior, that's a cuspid, and that's the first bi, and this 6-year molar is all the way up to here. If this is a 6-year molar, I'll have to check on the wisdom teeth later on. Similar thing on the other side. We've got a cuspid, the first bi, and the second bicuspid is missing, and we're going to show that on the x-ray just pretty quick here. Now these teeth are missing like this. You know, we know how to deal with them, and I did not actually do this myself, but somebody else came in that did this, and it hasn't worked out. It worked all right. Now this is where you've got a 12-year molar and a wisdom tooth. I mean a 6-year molar. You got a 6-year molar, 12-year molar, and there's a wisdom tooth forming back there. And you can see the same thing over here in this area. And I don't see any wisdom teeth up above on this particular case. But we got a pretty crowded problem right in here with these teeth coming down. That's the cuspids coming in between those laterals. So here we go in and reduce this tooth and take a pulpotomy on that. Take this tooth down, did a pulpotomy on that. And now, when this tooth right here was done, I did not do this, but somebody else, and they didn't do this properly. So let's see, that's 12 of 84. She's age 6 and 4 at this time. Now here it is 8 and 2, and this tooth is still missing in here, and we're going to take part of this off right here and let these come in. That's what we had drawn in here to do, and we did the pulpotomy on these, and we pulled the laterals down in place. We got cuspids coming up here, and we'll wait and see how they do. We don't show any wisdom teeth forming up here, so we will try to keep everything we can. In fact, this didn't form, and these are let's see, she's 8 and 2, and these I assume are 12-year molars right here, but she's kind of late getting the 12-year molars that might be missing a wisdom tooth. All right, we recommended taking this tooth, cut it into and extract this half right here, and you got to come down and you got to clean that thing out real good. And somebody else did that, but they didn't pack that thing solid, and so you got a problem with that coming in. Now, they took it out, packed just a little bit. They needed to go down and really fill that in. And now this tooth has been removed right here. They had that area, and we've got probably a drainage problem there. But this portion right here held this tooth up and let this one go underneath there. And that's the trick of the doing where you've got a missing tooth. Now let me go back to that first. Now you see this deciduous tooth right here. Of course, it's resting on this, but if you take this out, then this part right here will move over, and this portion here kind of holds that tooth up while that moves in that position. And that move worked out good. And now we've got missing bicuspids on this side of the mouth. Now over here we've got the 4 anterior teeth, the cuspid, the first bi, the second bi, the 6, and the 12-year molar, the wisdom tooth back here. And we did develop a wisdom tooth up above too. So this is, she's 13 years old now at this point, and this is 1991. And that's when we took over and started doing the case. And so we banded that back up. That was 91 and 92. We lined those teeth up, and we slid the 6-year molar up to the first bi. And over on this side, we've got the cuspid of 2 bis, so there's nothing missing over here. This is coming in, so we got more room for this wisdom tooth to come up in this area right here. And if you bring it up, it's going to extend back here. This tooth might come down and rest on that, and she might keep the upper wisdom tooth. Over here, this is pretty well filled up, and it's likely that you're going to need to take the wisdom tooth out over there. Now this one, of course, if you take that one, you're going to have to get the upper one too, probably. All right, let's go and see what we got. So this is 1993. So we bring this tooth up underneath here, and we center in, and she's 14 and 8, 93, and they to take out the wisdom teeth, even though we didn't want to take a chance of this one coming down and having enough contact there. So we let this tooth erupt in behind there, and it fills in where there was a missing tooth there. So this is 94, and the wisdom teeth are gone now, except for this one, and we'll have to make a retainer and hold this tooth in place where it can't come down in there while that comes in. I don't know whether I've got another x-ray here or not. I don't think so. Now here is what we started off with, and here's what we ended up with. Now this is 93. We get those teeth together. That's 93. Now, these are things you could do on adult orthodontics. You have to learn to close the back teeth forward when you're missing teeth in between in that area. So thank you for watching, and we hope you picked up some idea looking at this young lady when we started the work. So say goodbye and thank you for watching. Hope you'll join our deal. And if you need to learn orthodontics, the starting stuff, join the AOS. It's in Grapevine, Texas. So we'll close out here and say goodbye.